SallyAnn, welcome.
Thank you, Manish. Good to see you.
Thank you for joining us today. So before we go into some of the sessions, it'd be good just to kind of get your hot take on where we are at the moment as a sector, some of the challenges, I guess, that you are facing in your own role, and maybe some of the, I guess, what you would say to those that are watching today around what more we could all be doing.
Yeah, so I suppose it won't come as a great surprise to know that a lot of the challenges that Aberlour faces as an organisation are similar to those of other organisations. When you're in a situation in the context of a global pandemic, with almost probably more than a decade of austerity that predated that, straight into a cost of living crisis, it doesn't take a genius to work out what some of the challenges we face are, and some of the challenges that Scotland faces as a nation. So we as a charity have campaigned for a long time on poverty-related issues, structural inequalities, and how we actually try to rebalance how people experience life in Scotland to make sure that people get the best possible start, children get the best possible start, and actually live in families that are able to thrive. That is a massive challenge at the moment. We're looking at 1 in 4 children across Scotland living in poverty in this great city that we're in at the moment. In pockets of this city, 1 in 2 children living in poverty. So what we know about the experiences that children living in poverty can have, it's not inevitable, but there's an increased likelihood of them experiencing difficulties in education settings or social outcomes or health outcomes. So that within the context of continuing austerity, rising food inflation, rising cost of living for people, it really takes us to a point where the influencing work that we do with government has to be really very sharply focused on how we get the right type of support to the people that need it the most in society, because actually a lot of what we offer in terms of the universal services doesn't adequately meet the needs of those most in need.
Yeah, and so how do you go about making sure that we're not just propping up the state, or where the state is failing to deliver in its services, and we're not a sticking plaster for the failures of the state?
I mean, I think that's a really interesting question, Manish, because I think that actually the history of philanthropy in the not-for-profit sector in the UK has just been about that in many ways. You know, so if you look at the history of the development of an actual state infrastructure to support health, to support education, to support social care, it's actually relatively recent. And prior to that, we depended on the charity sector to step into the spaces where the state would not go or could not go. And I think what we have here is a situation where the state has developed a response, thank goodness for that. But we're actually at a kind of tipping point where if we're not careful, we will be very quickly back to a situation of real disparity in terms of what people receive from the state in terms of support. And so for me, part of the answer to that about not just being a sticking plaster is accepting that sometimes we are a sticking plaster. And there's an inevitability to that, because the level of need is so great that I'm not quite sure how we change that unless the state starts to make very different, much more radical decisions about how it distributes the money and the support to its population. And sadly, I don't see that changing anytime soon. So there is a bit about us being a response to an inadequate state provision. But I also think that our influencing work really needs to focus on how we support those furthest away from privilege and power to exercise their voice, to state very clearly how some of the policy decisions that politicians make and policymakers make have a direct impact on the lives of children and families.
And we've got some really ambitious policy measures, haven't we? So we want to eradicate child poverty in Scotland. We want to eradicate homelessness. But you're giving us figures there that are really shocking for any country. But I think for developed countries in the modern age to have almost 1 in 2 children living in poverty in Glasgow is shameful. But what more can be done to move the government from rhetoric, I guess, to real action on these things? Because we're not seeing the needle really shifting on them.
So I think part of, that's your word, rhetoric.
Yeah.
But I'll repeat it. There is rhetoric from politicians that grandstand on key equality issues. And what we don't see is a follow through in terms of investment. So we have a commitment to a wellbeing economy. We still don't construct our budgets based on a wellbeing economy. So that's the first challenge. Start with the citizens who need the help the most and build your economy from them. I think there are a range of policy initiatives that are fantastic that would be celebrated across the globe. And I've been involved in some of those intimately and some of those at a distance. But one of the things that we need to do is make sure that at the point where we make the policy decision, that we put in place a financial framework that allows that policy to be implemented. Yeah. And I could cite a number of policy intentions that are fantastic, including leaving care entitlement for young folk coming through the care system, and their entitlement to aftercare support into adulthood, that is simply not being resourced effectively enough. So we're left with a position where there is a legal entitlement but no financial resource that's adequate enough to actually get the support to the young people individually that they need. And I could cite a number of those. And part of our duty, I think, and my duty as a chief executive, is to step into that policy space, not to give my opinions. Nobody's interested in my opinion. But I think what people are interested in is the opinions and the experiences of the children and families that Aberlour supports and that other charities support. So what we try to do is take those voices into that public policy space and hold a mirror up to politicians and say, you said this, but this is the experience that people have. So brilliant examples of that are people living in poverty, the impact of the Scottish Child Payment and the positive impact that that's had, a great policy initiative, but we know it's not enough. You talked about our wish to, our plan to eradicate child poverty. We're going to miss targets unless we do something quite radical. So we need to look again at the Scottish Child Payment. Is that enough? And just this week, we're, a whole range of organisations have spoken to government.
There's a lot of activity online, just calling on the government to raise that payment.
Yes, and one of the things that we've found out in our research too is a whole bit about how state can also harm the most vulnerable families, the people that are furthest away from power and privilege. So one of the things we've looked at is the impact of public debt, for example, on those who have the least. And there are significant numbers of families who are in a perpetual state of destitution. And the Joseph Rowntree Foundation report from a couple of weeks ago backs this up, that even from the get-go, because of the amount they're having to pay back to DWP or council tax or rent arrears, they are in a state of destitution. And there is something that the state I think needs to think about in terms of how they deal with that. A compassionate state in one of the richest countries in the world, and let's bear that in mind, can make political choices that can improve the lives substantially of those furthest away from privilege.
So I'm definitely taking away power, privilege, proximity and choice.
Yes, and I think, looking at the kind of recent history, I think the COVID response is a brilliant example of where proximity was really, really relevant. So there was a national endeavour, wasn't it, at UK level and Scottish level around COVID response, and that was right and proper that should happen because people needed support right away.
Absolutely.
What I would argue is that the families that are living on the margins of poverty or in poverty have been in that situation and in and out of that situation for over a decade and more.
Absolutely.
And I think there is as much of an urgency around that situation as there should have been, as there was around COVID. And I think one of the issues that we face is that the decision makers, the policy makers, the people with the power are further away from the experience of living in poverty and all that brings, which means that decision making is flawed and it's not given the urgency that it needs in terms of trying to change the experiences of those families.
And do you think that places an extra burden on the voluntary sector, on the third sector, to bring those stories to more proximity to the decision makers?
Absolutely.
I feel like that in many ways that is our role, as you were saying, like you're carrying the voices of the families and the children that you're supporting. I think for many other charity leaders and those, it's about getting those people at the table and having that lived experience in the decision making is so critical.
Yeah, absolutely. And one of the things I would say is that so we we're very careful about how we use the stories that families give us permission to use or families speak about. And we've had to rethink how we do that. And part of that is about completely respecting people's position in relation to, if we want people to go to an event, we should pay them to be there. We shouldn't assume that they will come and bring all of their experience free of charge. I think generally we've been a wee bit slow to recognise that actually our families are true partners in the work that we do. And I suppose the other thing is that so much of the lived experience voice touches on fairly traumatic, difficult experiences that we need to make sure that we give people support and that we don't in any way just tick a box by getting somebody who has a pretty horrific story to tell to come along, tell their story and go away. Because what people are saying, certainly some of the people I've spoken to who have spoken on very big platforms about their experiences, so what they've said to me on occasion is, I wish I could just have held something back. I feel as if I've overshared. I don't think I got enough support to actually draw a boundary for myself in terms of what I could have not said about my experience. So I think when we take that lived experience into the room, we absolutely have to do it on the terms of the person that is telling their story and speaking about their experiences, and not cajole people or encourage people to overshare information that can be quite very private and involve quite intimate things for them.
We're not always the best at putting the kind of scaffolding around people to really support them to do that, because it's a big step to do it. No, absolutely.